Hello everyone and welcome to another episode of Ask Dr. Bob. Had somebody ask me a question about Lyme disease, and I want you to know we are seeing more and more individuals that are coming into our practice that have very unusual body signals. So Lyme disease is quite common today, especially if you live in the Northeast or in the Midwest and you have any kind of animals around. We use a product called Phytolin, POA, but we have also used a product called ADP, which is emulsified oregano. It's a very serious condition, and even the testing for it is not always totally true and right spot on. So if you've been diagnosed with Lyme disease, you really want to take it very serious. A lot of times I'll have individuals that have had vague issues for years and years, and someone will finally say, hey, you know, I think you may have Lyme disease, and in fact they are tested. So if you've been suffering for a long time period and don't know what's happening, you obviously are going to want to talk to your healthcare provider about having some testing done for Lyme disease. Dr. Bob, I have an individual in my life who has asthma, 11 years old, and have had and using an inhaler, wanted to know what else they could use. Well, this is what I've noticed with individuals who have asthma. A lot of times it is stress. And when I see asthma, especially in young children, there's an oil that we use called black currant seed oil. Great success. You know, I practice clinically as a chiropractor, and I also have a doctor of natural health degree. Oftentimes, we notice that these children have straight necks, and it should be C-shape. Probably 25% of our practice is a pediatric practice, and kids respond well to non-forceful chiropractic care. No dairy, no citrus, no sugar, but stress is an issue. Black currant seed oil could help a lot. Dr. Bob, I'm a registered nurse. Recently I suffered with a UTI. Started taking apple cider vinegar and raw honey, and the symptoms vanished, and this individual did not want to be on medication. I'm seeing more and more individuals today in our practice have UTIs. Could be for a lot of reasons. First, I would not drink alkaline water. It'll throw the pH off in your body, and the purpose of this video is not to explain why not to use alkaline water, but it throws your digestive pH off and your ability to absorb nutrients in your body. She was using the apple cider vinegar. I think that was an awesome idea. Cherry juice may be another juice, or cranberry juice would be a juice that you could also use. Everybody is different with their urine pH. I wouldn't necessarily stay on the honey a long time period because it is sweet and obviously unfriendly organisms like sugar. I would drink plenty of water, but what I want to share with you right now could be a huge tip for you. We use a product called Hydrozyme. It's a digestive enzyme. I see that most individuals that have chronic UTIs may need, in fact, a digestive enzyme. We also use a product called ADP, which is emulsified oregano. Drink enough water, back off on soda, back off on drinking a lot of coffee. You want that urine flowing freely and uninterrupted. You know, just be aware of what type of panties you might have as a female. There's a lot of chemicals today that are in panty liners, and this is a very, very serious issue with all the different chemicals. Hello, Dr. Bob. I discovered you yesterday and my life really changed, and this individual wanted to know how to participate with our consultations. It's very simple. Go to druglessdoctor.com and link on to consultations. Dr. Bob, I have a problem or a challenge with depositing of redness in my lower legs. Well, there's a term called Hemosiderin that's really like the deposit of blood cells that just aren't functioning optimally in your body, either from stress to the liver or spleen overload. If we have somebody that has a hemosiderin deposits, which is that deep redness in the lower legs, I first would bounce on the ball. But you definitely are going to, bouncing on the ball means you're going to get a 55 or 65 centimeter ball, and you're going to bounce on it 4 or 5 minutes every day. But you may consider having your liver enzymes tested. That would be like your ALT and your AST. And you may also want to have an x-ray of your pelvis to see if you have an enlarged liver. These are tremendous questions, and some of them we've never had before. I'm Dr. Bob DeMaria, the Drugless Doctor.